Today we are going to talk about lumpy jaw in cattle, what causes that hard swelling along the jaw, and why early treatment is so important. Lumpy jaw is the common name for bovine actinomycosis, a chronic bacterial infection caused primarily by Actinomyces bovis. This bacterium normally lives in the mouth of healthy cattle, so lumpy jaw is generally not spread directly from cow to cow. Instead, coarse hay, plant awns, sticks, erupting teeth, or other sharp material damages the oral lining and allows the bacteria to invade deeper tissues. Once Actinomyces bovis reaches the jaw, it produces a slowly progressive pyogranulomatous infection and osteomyelitis, meaning inflammation and destruction of the jawbone. The body deposits new bone and fibrous tissue around the infection, creating the firm, immovable swelling that gives lumpy jaw its name. Draining tracts may eventually form and release thick pus containing small yellow or grayish granules made up of bacterial colonies and inflammatory material. The mandible is affected most commonly, although the maxilla can also be involved. Early in the disease, the cow may continue eating normally. As the lesion progresses, teeth may loosen, chewing becomes painful, and the animal may drool, lose weight, or eventually become unable to eat. Lumpy jaw should not be confused with wooden tongue. Wooden tongue is caused by Actinobacillus ligneurisii and mainly affects the soft tissues of the tongue, whereas true lumpy jaw is centered within the bone. Diagnosis is often suspected from the characteristic hard jaw swelling. Radiographs are especially useful because they can show areas of bone destruction surrounded by periosteal new bone and fibrous tissue. Cytology with a gram stain of a deep aspirate, pus, or sulfur granules can reveal branching, filamentous, gram-positive organisms. Anaerobic bacterial culture can confirm the diagnosis, but false negative cultures are common because Actinomyces can be difficult to grow. A biopsy with histopathology is useful when the diagnosis remains uncertain. Treatment works best before severe bone destruction develops. The treatment of choice in ruminants is sodium iodide, usually administered slowly intravenously at approximately 70 mg per kilogram using a 10 to 20% solution. It may be repeated several times at 7 to 10 day intervals. Sodium iodide is an iodide preparation, not an antibiotic, and it does not directly kill the bacteria. It may instead enhance cellular oxidative mechanisms that inhibit bacterial growth. The cow must be monitored for iodism, or iodine toxicity. Signs can include dandruff-like skin changes, excessive tearing, coughing, diarrhea, poor appetite, and nasal discharge. Treatment should be stopped or spaced farther apart if these signs develop. Sodium iodide should also be used cautiously under veterinary supervision, particularly in pregnant cattle. Antibiotics are also used because lumpy jaw is a bacterial infection and the abnormal bone and granulomatous tissue can protect the organism from treatment. Veterinary references specifically describe penicillin, oxytetracycline, and florfenicol as antimicrobial options, usually given along with iodide therapy rather than as a replacement for it. Oxytetracycline is a broad-spectrum tetracycline antibiotic that binds the bacterial 30S ribosomal subunit and inhibits protein synthesis. Published cattle products commonly use approximately 6.6 to 11 mg per kilogram once daily, or a long-acting dose near 20 mg per kilogram, depending on the formulation and indication. Because treatment of lumpy jaw may be extra-label, the veterinarian must select the exact product, route, duration, and withdrawal interval. Penicillin G-procaine is a beta-lactam antibiotic that inhibits bacterial cell wall formation. A labeled cattle dose for some 300,000 unit per milliliter products is 3,000 units per pound, which is approximately 6,600 units per kilogram, given intramuscularly once daily. However, using penicillin specifically for lumpy jaw, changing the dose, or extending treatment may be extra-label and requires veterinary oversight and an appropriate meat and milk withdrawal interval. Some published field reports have also described penicillin combined with streptomycin and oral potassium iodide, but treatment protocols vary, and these reports do not replace current veterinary drug regulations or product-specific withdrawal guidance. Any accessible soft tissue abscesses or draining pockets may be opened, debrided, and flushed under veterinary direction. Simply lancing the hard swelling will not cure the disease because the infection is embedded within the jawbone. Even after successful treatment, the existing bony enlargement may not disappear completely. The prognosis is best when treatment begins early. Cattle with extensive osteomyelitis, severe weight loss, loose teeth, or an inability to eat have a guarded to poor prognosis, and humane culling may be necessary. The big takeaway is that lumpy jaw is a chronic Actinomyces bovis infection of the jawbone, not just a superficial abscess. Early recognition, radiographs, cytology or culture, iodide therapy, appropriately selected antibiotics, and removal of coarse traumatic feed provide the best chance of stopping progression before permanent jaw damage becomes severe.